Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Questions 25. You hear a nurse talking to a doctor during a patient handover. Now read the question.
The patient's blood pressure has been consistently high despite the current medication.
I see. We may need to increase the dosage or add a new medication.
Shall I prepare the chart for your review?
Yes, please. I'll assess the options and make the necessary adjustments.
Questions 26. You hear a physiotherapist discussing a rehabilitation plan with a surgeon. Now read the question.
The patient is recovering well after the surgery, but I'm concerned about their mobility.
Do you think we should extend the physiotherapy sessions?
Yes, increasing the sessions will help them regain full movement faster.
Agreed. Let's proceed with your recommendation.
Questions 27. You hear a senior nurse briefing a junior nurse about patient care. Now read the question.
The patient in room 12 needs to be monitored closely for any signs of infection.
Should I check their vitals more frequently?
Yes, and make sure to document any changes immediately.
I'll keep an eye on it and update the chart regularly.
Questions 28. You hear a radiologist discussing a scan result with a general practitioner. Now read the question.
The scan shows a small lesion in the patient's lung.
Is it something we should be worried about?
It's small, but I recommend further investigation to rule out any serious conditions.
I'll arrange for the necessary tests.
Questions 29. You hear a dietitian discussing a patient's diet plan with a doctor. Now read the question.
The patient's cholesterol levels have improved, but we need to adjust their diet to maintain these levels.
What changes do you recommend?
I suggest reducing their intake of saturated fats and increasing their fiber intake.
That sounds like a good plan. Let's implement those changes.
Questions 30. You hear an anesthesiologist discussing a patient's pre-surgery condition with a surgeon. Now read the question.
The patient's blood pressure is slightly elevated, which could pose a risk during surgery.
Should we postpone the surgery?
Not necessarily, but I'll adjust the anesthesia plan to accommodate this.
Let's proceed with your adjustments.
That is the end of Part B.
AVN Pharma Education.